Okay, welcome to a Saturday morning edition. I'm Dr. Doug Pucci for the Root Cause Solution radio show. Happy to be here with you live on this Saturday morning. I'm in the East Coast, New Jersey, so anyone who's listening maybe outside this area, for the first day, I think in the month of July, we actually have nice weather. It has been a difficult July, a lot of rain, a lot of storms, a lot of mugginess, right? So finally we have a really nice day. So I am looking forward to being outside today. Yeah, so good. We've been working a little bit on the themes over the last few weeks on the subject matter of detoxification. And we did speak about the liver detoxification pathways a bunch. We talked about hormones. And so today we've been getting a lot of questions regarding skin issues. So I'm going to be sharing some insights and answering some questions. I think, the most fun thing that I have is to not be here and just have a subject and just ramble on and talk about it. I really want to be engaged with you and answer the questions. That's, I feel, the best way that I can provide some insight is to answer questions live. So I'm going to invite Cynthia over here to ask me some questions that she's been receiving. All right, so let's take it away.
Yeah, so the first one is what kinds of skin problems are signs of detoxification issues?
What types of skin issues?
Last week we were talking, or 2 weeks ago, we were talking about liver detoxification. So when do you know that you have a skin issue that's a sign of a detox? Your skin is a detoxifying organ.
All right, so when do we know that the skin is representing a detoxification problem? Okay, your skin, right? Your largest organ of your body is your skin. We don't think of the skin as an actual organ. We think of the liver as an organ or the heart as an organ, but your skin is an organ, right? And your skin is actually a barrier to the outside world, right? That's why we don't want, if we get a cut on our arms, right? We want to clean it and maybe put some vasotracin on it, and we put a bandage on it, right? So that we prevent an infection from getting in. So it's a barrier to the outside world also, right? But our bodies also use the skin from a detoxification perspective, right? That's why we perspire, right? We sweat out toxins. So it's a major detox organ. What we tend to see is that when the body's, so the detoxification system, again, is a system, right, which incorporates more than one organ. So the liver being maybe considered the largest detox organ from the standpoint of its metabolic processes, but your gut is involved, your lungs are involved, your lymphatic system is involved, right? Last week we spoke about the brain's detoxification called the lymphatic system, right? All of these are working cohesively as a drainage system to remove toxins from the body. But when this drainage system is working slowly or sluggishly, right, the toxins can start to back up and we kind of get an internal toxic overload. And so many times it starts to come out in the skin. So we kind of think of that in that regard. How do we determine that when we see signs of skin issues? I think it's more like if you're seeing ongoing or lingering skin issues that are not abating, right? Just if you got a mosquito bite, right, you see it swell up. You get an itch, you get an itchiness to it. And then after a few days, it kind of comes back down again, right? Or if you got poison ivy, a dermatitis where it came on skin contact, right? You had a skin contact, you see the rash kind of going, you put some creams on it, it kind of calms down a little bit, and then it dissipates in some time. But when we have skin issues that seem to be erupting or ulcerating or rashing that is coming and going and coming and going, or doesn't really dissipate even with the administration of creams, you're really thinking more in terms of an internal issue, whether it be detoxification itself or whether it be some immune reactivity internally. Okay, I hope I kind of answered that.
So explain the difference between like a psoriasis and an eczema.
Okay, so what's the difference between psoriasis and eczema? Okay, good question. They are both skin issues. From my perspective, they are both internal issues. So when I see both eczema and or psoriasis, I'm really thinking more in terms of toxicity issues internally. The first place I'm going to think about is the GI tract or the gut environment, from the standpoint of either overgrowth of bacteria, overgrowth of yeast, but basically the gut producing toxins to the point that it's being expressed through the skin. Also, again, whether it be lymphatic also, but it's an internal representation. What really differentiates the eczema from the psoriasis, though, is that the psoriasis falls into a different category because psoriasis inherently is autoimmune driven, where the eczema is in all likelihood not autoimmune driven. So what does that actually mean? Is that if you're seeing somebody who has psoriasis, right, is you really now, my approach is more immunologically driven, right? What is creating the imbalances that drives more of the immune system to basically be causing some destruction to the gut environment, which is being expressed as psoriasis. Does that help a little bit? Yeah, okay. So what other questions we have?
What's the difference in how they look? What does one look like versus one you don't look like?
Yeah, they can look similar. Sometimes it's hard to discern. They can look similar. But I think that, with the psoriasis, you're going to see more patchiness. You're going to see more ulcerations. Basically, what's happening in psoriasis is that I think, don't quote me, but I think like your skin cells turn over roughly every 2 weeks. So every 2 weeks, new skin cells are coming up to the surface, then they slough off, and the other cells kind of come to the surface. And that whole life expectancy for that cell is about 2 weeks. So what's happening in psoriasis is that is happening much faster. Like those cells are replicating like in about 2 days. So it's more of an ulcerative state, right? So the scaling is more red, it's more blistering. They can crack and peel and bleed, can get very, very itchy. So, eczema is usually a little bit more of a milder sort of appearance to that, right?
And does one clear up with topical creams?
No, they don't really clear up with topical creams. I can just state my own personal experience. So many years ago, I lived in New York City. And when I lived in New York City, you go out, you eat out a lot, right? And that's why I lived in New York City, right? But the tendency is when you're eating out, I was eating out and probably eating a little bit too much rich food on a consistent basis. And I would have my own observation. And so there would be a point where my elbow started to develop eczema. I was getting on the back of my arms and my elbows. As soon as I began to see that sort of red patchiness, which I knew was eczema, I knew that my body chemistry was becoming too acid, which was a representation of a more acid-based diet. And I was seeing the signs of that in my skin. So I would then use that awareness of the eczema on my skins to change my diet. Right? I use it as a sign. So, okay, my diet is too acid-based, and I'm going to switch, and I move more into a plant-based diet, a more alkalized diet. And I would do that for a period of time. And within 10 days to 2 weeks, I would begin to see the improvements in my eczema.
So you would define that as a defining characteristic, is that eczema might clear up, whereas psoriasis might not?
Psoriasis can clear up to a degree. So eczema is going to respond more favorably, more quickly to things such as dietary changes. But it can go more. It can be more than just dietary changes, right? It goes to the gut ecosystem, many things. But eczema, you tend to see a better response to the dietary changes, for example, right, and hydration, different things. Again, because psoriasis is now really an autoimmune condition, right? It goes even beyond just the diet. I mean, the diet is an important part of regulating your immune system response, right? But the autoimmune is way more complex, right? So you got to rule in and rule out infections. You got to rule in and rule out things that ebb and flow your immune system, right? So it's like when I work with somebody who has psoriasis, we're just aware we have this condition, but I am helping that patient and coach them through the management of it from a immune perspective. It's an immune management job, right? In the dermatological world, right, they were just going to give you creams. And if you think about it, right, as a dermatologist, they're going to give you creams to put on topically to the psoriasis, which is primarily what? It's a steroid cream, right? And what does a steroid cream do, right? It tries to downregulate or suppress, or it calms down inflammation. So it's effective temporarily, right? Because the steroid, down-regulates inflammation. But again, we go back to what's inflammation. It's an immune system response.
Well, isn't that what the drugs are?
All of them. So when you watch the TV, you see all these commercials I mentioned to you, I mentioned this in the last Saturday show, right? There were so many commercials that we see. Every other commercial in a half-hour slot was a drug commercial, and every commercial was for some type of a steroid, right? So many people have seen the commercial for the golfer Phil Mickelson, right, who talks about having psoriatic arthritis, and he's using the prescription drug Enbrel, right? So psoriasis psoriatic arthritis is the combination of psoriasis along with joint degeneration. Right? So psoriasis can progress into psoriatic arthritis where now you get joint degeneration along with the psoriasis, right? But again, it's autoimmune. And so what did the doctor treat him with? Enbrel, which is what? It's a steroid. It's a powerful steroid, which is immune suppressing. So it's shutting down the immune system. That way it shuts down the attack on the tissues. Short-term use may be okay. But again, what's the consequences of the long-term use? Well, you're shutting down your immune system for an extended period of time, which is going to make you very susceptible to infections and diseases, and in cancer. There's a high risk of cancer. Why? Because the job of your immune system is surveillance and to see when you're developing cancer cells and go in and eradicate that. So if we're suppressing the immune system with these drugs, you're going to raise the risk of cancer. That's why they tell you in these commercials, tell your doctor if you're getting infections, tell your doctor this, tell your doctor that, right? Because it's all, you're getting immune suppression and you're susceptible now to more serious infections. But that's all they offer in the medical world.